and welcome to Good Morning America Health. I'm your host, Tanya Rivero. Labor Day has come and gone. The kids are back to school. But this year, as cold and flu season approaches, a lot of parents are on alert and are wondering, when do we keep the kids home from school? Joining us once again for a segment we call Back to Basics is pediatrician Dr. Ilana Levine. Dr. Ilana, thanks so much for coming back on the show.
Always a pleasure, Tanya.
So this issue of temperature is one that's tricky for a lot of parents because I know that there's the worry, at what point do I call the doctor? At what point do I send my child to the emergency room? At what point do I keep them home from school? And you say it varies depending on a couple of factors.
Exactly. So here are the basic guidelines. First of all, if your child is under 2 months of age and they have a rectal temperature of 100.4 or more, do not give them Tylenol, do not give them any medication, call your pediatrician. Even if it's 2 in the morning, you want to make that phone call. I often say to my patients, don't call your mom first, call me first, because you don't want anyone else's advice except your pediatrician's. The first 2 months are a very sensitive time for babies, their immune systems aren't well developed, and you really want to be in constant contact with your pediatrician. After 2 months, I'm a little bit more liberal because lots of kids get fevers and they recover from them and do just fine. So really what I tell parents to look for are other symptoms. Are they lethargic? Are they looking dehydrated? The number isn't as important. So a lethargic child with 100.6 fever is much more concerning to me than a child with 104 who's sort of bouncing off the walls happy as can be.
Sure, but you would give them Tylenol to see if the fever comes down.
Absolutely. Okay. I mean, I think that the fever reducers are important in making them feel better, so you always want to give those to them when they need them, but in terms of how much you need to worry, you sort of have to look at the big picture of how the child seems.
And then when you have an older child, a school-age child, when do you keep them home if they have a fever?
Excellent question, especially now with this cold and flu season and the H1N1 virus. The CDC website is very clear. Any child who has fever of 100 degrees Fahrenheit or more needs to stay home until they're fever-free for 24 hours.
Just 100? That's lower
Just
than
100.
a lot of parents might think.
Exactly. And the other thing that parents need to know is you can't base this on fever reducer medication. It's not like you can give your child Tylenol, the fever comes down, and then send them off to school. You have to be off Tylenol, you have to be off ibuprofen, Motrin, Advil, all of those sort of fever reducers.
Now, do you think that they've lowered that in concerns with the swine flu coming up? Do you think the CDC made that
I don't know exactly
decision?
why they made that decision. We used to say 100.4. That may just be a trickier number for people to realize, but I think we all sort of have to be a little bit more cautious this cold and flu season.
Now, what if your child is at school and becomes ill?
Good question.
What then?
So the nurses and the administration have all been instructed to be sort of hypervigilant about taking children's temperature. We're also recommending that there's a separate area for children to wait to be picked up. So if they develop a fever in school, if they're 101, instead of being in common areas where all the other children are, they should sort of be confined to a certain area where there aren't healthy children to keep everybody else protected.
Until they can be picked up if they need to go home.
Exactly.
Now, once your child is sick and is at home, you've got concerns about the rest of your family. If you have other kids, or even just passing it on to yourself, your husband. How do you control it once the child is at home and sick?
The number one thing you can do is excellent hand washing. Everybody should be washing their hands much more frequently than they ordinarily would be. Certainly before and after food, before and after going to the bathroom. If it's been a couple hours, wash your hands. My first choice is warm water and soap.
Okay.
For 20 seconds at least. If you don't have access to that, one of the hand sanitizers will work as well.
I was going to ask you, those are as efficient?
Number one, I'd prefer the soap and water, but they're a good second line.
So if you're out and about, you can keep one in your bag and constantly use it on your kids as well.
Absolutely. And if one child is sick at home, you really want to keep a 6-foot distance between that child and other family members.
That can be tricky when you've got young kids.
It can be tricky. And the other thing is, I would suggest sort of designating one caregiver so that you're only exposing one other person to the sick child. That can also be tricky, obviously, with work schedules and things. But as long as you're being smart and you're washing your hands and you teach your kids good, what I call respiratory etiquette, which is to cover their coughs and sneezes. You don't want them to sneeze into their hands.
You recommend the elbow.
I like the elbow.
Yes.
Yep.
What about the surgical masks? Are those effective?
Well, they're not going to prevent the spread of infection 100%, and they're not really going to protect you per se from getting sick. So if you walk around on the street with a mask and somebody is sick around you, you're not really well protected.
Right.
The instance where I would recommend it is if you do have a sick child in the house, let them, the person who's sick, wear it. It won't protect other people 100%, but it will contain some of the germs inside of the mask.
Okay. Now, what about college-age kids? What do you tell your college-age kids about A, being safe and not, contracting colds and flus, and B, not spreading them once they've gotten something?
Right. So the first thing you need to do is educate your kids before they go off to college. Let them know what a fever is, and we're saying 100 degrees Fahrenheit or more. Make sure they go to school with a thermometer. They need to go to school with fever reducers so that if they do get sick, they're not running out to the stores and tramping all over town.
That's an excellent tip. Just make sure that they're prepared,
right.
like a Boy Scout.
Exactly. And you also want to sort of find out what contingency plans the schools have. Do they have a separate area, a separate dorm area for kids who are sick so that they can all stay together and keep the other children healthy? Are there separate bathrooms, eating areas? We all just sort of have to be smart and proactive without panicking going into this flu season.
Sure. All right. Thank you so much, Dr. Ilana Levine. And for more health news and information that's good to know, please visit the health page at abcnews.com. We'll be right back.